my name is Destiny. I'm a student nurse at Irvis. Today I will be performing a neurological assessment on you today, okay?
Okay.
Now that does involve some inspection and some touching. Is that okay?
Yes.
Okay. Now do you mind showing me your wristband and telling me your name and your date of birth?
Ricardo Moreno, November 11th, 1995.
Excellent. And do you have any allergies?
Nope.
Okay. So we have a 24-year-old male sitting upright, no signs of discomfort or pain, appears to be calm and cooperative, and is appropriately dressed for the weather, and appears to have no obvious facial drooping. Okay? So I have a few questions for you before we start, okay?
Okay.
Have you had a history of seizures or convulsions?
Nope.
Okay. History of falls?
No.
Okay. Do you have a past family medical history of neurological disorders?
No.
Okay. And have you had any surgery on your spine, your brain, or your nerves?
No.
Okay. And do you take any medications?
No.
Okay. Excellent. And no falls, you said?
No.
Okay. Thank you. So that concludes my my questionnaire for you. Now I will be beginning the assessment. At any point in time, if you feel pain or discomfort, please let me know, okay?
Okay.
Okay. So first, I am going to do a test for your dullness versus sharp sensations, okay?
Mm-hmm.
So I am going to touch your arms and your legs with the dull and the sharp end of this pencil, and you have to tell me which one you feel. But you have to do this with your eyes closed, okay?
Okay.
Okay, so I'm going to begin. Do you mind rolling up your sleeves for me, please?
Mm-hmm.
Thank you. Okay, going to begin.
Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp.
Excellent. Gonna do the other arm.
Sharp. 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 Dull. Sharp. Dull. Sharp. Dull. 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 Dull.
Excellent. Okay, now I'm going to do the same thing with your lower extremities, okay? So
Okay.
please still have your eyes closed.
Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Excellent, you can open up your eyes. So, patient appears to be able to differentiate between sharp and dull sensations. Excellent. Now, I will be doing a stereognosis test on you, okay? So for this, I'm going to have you have your arms open, palms up,
Mm-hmm.
okay? Your eyes will be closed. I'm going to put an object in your hands, and then you have to tell me what you think it is, okay?
Okay. Is this a hair clip?
Yes. Keep your eyes closed. I have one more object for you.
Is it a key?
Yes, it is. Good. So your stereognosis appears to be intact. Now I'm going to do a graphesthesia test on you, okay?
Okay.
So for that, your eyes will have to be closed as well with your palms out straight ahead.
Mm-hmm.
Now for this, I'm going to draw something on your hand, and you have to tell me what it is, okay?
Okay.
Now it's going to be like a letter or a number, okay?
Mm-hmm. It is an I.
Yes.
And it is a 3.
Excellent. Good job. You can open up your eyes. So your graphesthesia appears to be intact as well. Now I am going to test your kinesthetic sensations, okay?
Mm-hmm.
For that, I am going to have you put your arms out for me again. And so I'm going to press down or up on your fingers, okay?
Okay.
You're going to have your eyes closed. I'm going to press down or up on your fingers, and you tell me which one I'm doing, okay?
Mm-hmm. Down. Down. Up. Down. Up. Up. Down. Up. Up.
Excellent. Good job. So that tells me that your kinesthetic sensations are good for your hands. Now, do you mind taking your socks off for me?
Mm-hmm.
I'm going to do the same thing on your toes.
Okay.
Now, before that, I'm just going to palpate your legs to make sure you have some feeling in there, okay?
Mm-hmm.
Okay. Any feeling?
Yeah.
Excellent. Okay, so now I'm going to do the same kinesthetic test with your toes, okay?
Mm-hmm.
Close your eyes, please.
Down, up, down, 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 up, down.
Excellent, good job. You can open up your eyes. So your kinesthetic sensations appear to be intact as well, okay?
Mm-hmm.
So now, whenever you're able to finish getting your socks on, I need you to get up for me, please. For this portion, I'm going to have you put your arms straight ahead with your palms up,
Mm-hmm.
and have your eyes open. And now can you close them? Excellent, you can open up your eyes. No swaying noted. Good job. Okay, so you can sit back down for me, please. Now we are going to test your gross motor skills, okay?
Okay.
So for this, have your palm on your thighs, and can you do this as fast as you can?
Mm-hmm.
Excellent. You can stop. So your gross motor skills appear to be intact. Now we're going to test your fine motor skills, okay?
Mm-hmm.
So for that, can you have each of your finger touch your thumb like this as fast as you can?
Okay.
Excellent, good job. So your fine motor skills appear to be intact as well. Now I'm going to have you test your cerebellar function. So with this, I'll have your arms out as far as you can. Now have one of your fingers on each hand touch your nose like this as fast as you can. Excellent, cerebellar function appears to be intact, okay? So now we have a couple more tests for you, okay? So do you mind standing up for me again?
Mm-hmm.
We're now going to do the Romberg test, okay?
Okay.
So for this, you need your feet close together and your arms to your side, okay? Now look straight ahead, okay? Now have your eyes closed. Excellent, you can open up your eyes. No swaying noted. So I'm going to note that your Romberg test is a negative, okay?
Mm-hmm.
All right, so now we have one final test. Now, it's called the heel to toe test. So you're gonna have your heel follow your toe in a straight line as best as you can, okay?
Okay.
This is gonna test your balance and your coordination. Please begin whenever you are ready.
Mm-hmm.
Excellent, thank you. Okay, so it appears that your balance and your coordination is intact due to the heel to toe test, okay?
Okay.
So that concludes my assessment. Do you have any questions for me?
No.
Okay, thank you.
Thank you.